Hi, Dr. G here. Today I'd like to answer a question that I hear pretty often. People ask me, why do you focus on treating women? I think they find it particularly weird that I'm a guy, that as a man, that I'm going to be treating women. So let me answer that for you. In no particular order, what I think you get as a woman out of talking to me as a guy who happens to be a doctor is that I can show you the male way of thinking without the hubris or tension that comes with most typical interactions or relationships, right? I'm in this as a professional, and so we can be open, but I can also be honest about the man's perspective. I also think I understand and value the female viewpoint and way of thinking, and I'm not going to ask you to give that up. I see the benefit of coming from your perspective, but in doing that, I promise I won't mansplain down to you. Something I bring to the table that I think is the benefit of a woman working with a man, and partly why I like working with women, is that I am very practical, but I balance that with heart and compassion and warmth. So you're getting a little of this and a little of that with me. And I find that just kind of comes out more naturally with my female patients. I also provide a place for you to practice saying what needs to be said to others, maybe especially men, and it helps you determine what you want, to be okay wanting it, to value speaking up for it. And what happens in this exchange with us is that it's low stakes, because who am I to you? I'm your psychologist, I'm a professional, but it's still more real in the way that we role play some exchanges, so it can get you comfortable before the real show. I understand the complexity of life for women, but what's important is that I'm not in it, right? So I get it, but since I'm not a woman, I'm not going to bog you down with my own stories, my own tales, my own baggage. And I think that can happen sometimes, even in the most well-meaning professional relationships. Also, I don't assume. I ask. Part of this is that I'm not a woman. I'm not living your life. But in my curiosity to know you better, to understand you as a woman better, together we both get to know you better. And sometimes through explaining yourself to me, you figure things out. And again, unlike being with another woman, you have to say more. I think sometimes two women will talk to each other in this knowing sort of way, like you sort of trail off. You'll say, yeah, so Steve was watching the game and, well, you know. And then the other woman goes, yeah, you know. And, well, but maybe you don't know. You didn't get to say it all. You didn't get to talk it all out. So you get that benefit by talking to me as a man. And lastly, kind of going along with that, I'm curious. I'm curious about you, and I'm excited to hear more. And sometimes that's what you need, the willing listening ear, that you're not just venting, you're being heard. And with Dr. G, you'll be heard. So that's my take. That's the answer to the question in a very long way. Why do I treat women? I hope I'll be treating you soon. Look forward to meeting you. Be well, Dr. G.